Lung abscess. What is a lung abscess? It is a necrosis and cavitation of lung. Necrosis and cavitation of lung. Necrosis and cavitation of lung following microbial infection. It can be primary. More than 80% of cases. It can be secondary. It can be acute. Acute, that is less than 4 to 6 weeks. It can be chronic. It can be chronic. Can be chronic. Now coming to primary. Primary lung abscess usually arise from aspiration. Aspiration. In the absence of underlying pulmonary or systemic condition. Primary are often polymicrobial. So many microorganisms are there. Polymicrobial, including anaerobic organism and microaerophilic streptococcus. Including anaerobic and microaerophilic streptococcus. Microaerophilic streptococcus occur preferentially in dependent subsegments, that is posterior upper and superior lower lobe. Dependent segments. They occur preferentially in the dependent segments. Dependent segments. What are the dependent segments? Posterior upper and superior. Posterior upper and superior lobes. Posterior upper and superior lobes. Now coming to secondary lung abscess. Secondary lung abscess. Secondary lung abscess arises in the setting of an underlying condition. There should be an underlying condition. That is, it can be a post-obstructive process. So secondary abscess occurs in underlying. There should be an underlying condition. Now this underlying condition can be a post-obstructive process. Post-obstructive process. Or it can be an immunocompromising condition. Immunocompromising condition. It can be a post-obstructive process or an immunocompromising condition. So the different organisms are Pseudomonas aeruginosa, Pseudomonas aeruginosa, or gram-negative rods.